Welcome back. This is the final video in the UK Dental Pathway series. I hope you are enjoying the series. Please make sure to subscribe. So, in the first three videos, the focus was exams, roadmaps, documents, and clinical assessments. Now, the focus shifts completely what happens after exams, or in some cases, what happens is if exam progression is delayed for years. This is the most this is where most candidates either lose momentum or make strategic mistakes. Today the discussion moves beyond theory into real world clinical entry. The DCP route, post ORE registration steps, NHS integration through PLVE visa pathways, and the financial structure of UK dentistry. This is the transition from preparation to practice. The DCP alternative route. One commonly overlooked pathway is dental care professional registration, specifically as a hygienist or therapist. This route does not involve sitting or exams. Instead, eligibility is assessed through educational equivalence. Your undergraduate dental training is mapped against UK hygienist and therapist competencies. If accepted, you can legally work in the UK dental practices while your primary dentist registration pathway continues. This creates two major advantages. First is clinical exposure. You remain active in dentistry instead of stepping out of practice for long periods. Second, financial stability. You earn within the UK system while preparing for higher level exams or registrations. Now, the DCP application is not procedural, it is evidence driven. Three areas are critically assessed. First, syllabus mapping. Your academic curriculum must be aligned directly with JDC learning outcomes for hygienists and therapists, particularly periodontal therapy, preventive care, and radiographic principles. Second, clinical logbooks. You must demonstrate documented hands on experience in procedures such as scaling, root surface debridement, and preventive treatments performed on real patients. Third, academic validation. Official confirmation from your institution is required, typically from deans or clinical supervisors, confirming competence in relevant clinical areas. Weak documentation is the most common reason for rejection, not clinical deficiency. Now we will move on. Post exam full registration. Once ORE Part 2 is successfully completed, the next phase is administrative and regulatory. Step 1 is officially pass confirmation from the examining body. Step 2 is entry onto the JDC register as a licensed dentist along with payment of the annual retention fee. Step 3 is employment. At this stage, most candidates secure associate positions in NHS or mixed practices, often with visa sponsorship for international graduates. Step 4 is NHS performer listing. If NHS clinical work is involved, this is where supervised integration begins under structured clinical governance. Now, coming on the next slide, we will talk about the PLV structure. So, PLV or Performance List Validation by Experience is the NHS Clinical Induction Framework. It is a supervised period designed to ensure safe adaptation to UK clinical standards. Typically lasting up to 12 months, it involves working under an approved clinical supervisor in a validated practice. During this period, assessment is continuous rather than exam based. You are evaluated on clinical decision making, radiographic justification, record keeping, and patient management through workplace based assessment in adults and audits. Sorry for that. The objective is not testing knowledge but confirming safe independent practice within the NHS system. Now we will talk about uh, you know the clinical visa requirements, or you know just give me a minute. We have skipped a few things out of Okay, now we will talk about the clinical visa requirements for international student registration. Unlock access to the UK health and care worker visa. This visa routes includes several structural advantages. First, exemption from the immigration health surcharge, which significantly reduces long-term immigration costs. Second, accelerated processes compared to standard work visa. Third, a direct pathway toward permanent residency, typically after 5 years of continuous employment and a sponsorship. In practical terms, this visa converts clinical registration into long-term settlement potential. Now we will talk about NHS versus private sector dentistry. The UK dental system operates across two distinct financial models. The NHS model is based on units of dental activity or UDAs. Clinicians work against annual targets, delivering high volume structured treatment plans focused on essential care. This system prioritizes efficiency, accessibility, and standardized treatment delivery. In contrast, private dentistry is fee per service based. Earnings are linked to treatment value, often involving restorative, cosmetic, and elective procedures. Clinical time is longer per patient, and treatment scope is broader. Both systems have distinct advantages depending on career stage and long term goals. So, looking at to the strategic career development, successful clinicians do not attempt to transition directly into advanced private practice. The most stable progression follows a structured path. Initially, years are typically spent in mixed practice settings, combining NHS clinical exposure with gradual private treatment development. This allows development of speed, clinical judgment, and patient communication skills within a high volume environment. Over time, clinicians gradually shift toward private focused dentistry as expertise and reputation increase. So, this concludes the UK Dental Pathway series. Uh, Across these four videos, we have covered the entire journey from initial eligibility and document verification through OR examination, clinical assessment, and finally post registration career structure. The pathway is demanding and highly structured, but it is also clearly defined. Thousands of international dentists successfully complete this transition every year. The key variable is consistency, preparation, and strategic execution. If this series provided clarity, use it as a reference point for planning your next steps. Share your position on the journey, engage with the discussion, and stay consistent.